In terms of the safety of this drug, it's pretty safe. The types of things that we saw are things that we see with many of the other drugs. Certainly, patients had fatigue. There was some anemia, issues with nausea, occasionally vomiting, diarrhea. All of these are pretty consistent. Some patients had hand-foot syndrome, but tended to be of low grade, and very few of them had this as a dose-limiting toxicity or a toxicity that required a dose reduction. One of the sort of different or novel findings that we saw was some hair thinning or hair loss. You see this occasionally with Sutent and regorafenib. It is much more prominent with this drug. And I think one of the interesting things is oftentimes there is initial sort of round of hair thinning, and then the hair tends to regrow and oftentimes comes back coarser and curlier. So it is something to discuss with your patients because it is different, and prepare them. Interestingly enough, I think my guys were more upset about it than my gals in my experience, but it's always challenging. Having cancer, having GIST is a difficult walk through life, and then to have one other reminder that you're sick because your hair is falling out is another. So best to prepare patients. There were some patients who did have some skin changes, and so important for patients to be seen by a dermatologist. Many of these were things like actinic keratoses, which were not malignant. A few malignancies were identified, and so I think it's important for patients. Certainly at that age, they probably should already be getting, sort of annual skin checkups, but certainly making them aware that this is a possibility and having them monitor themselves and bringing to your attention any changes that they have in their skin. And lastly, I think ripretinib does have some VEGF targeting properties. And so blood pressure elevations was seen in some patients. And I think it's just important also to ensure normal cardiac function at baseline, and then just sort of ongoing monitoring. If you have a patient who you're concerned is having more issues with fluid retention, is this the drug, or could this possibly be a sign of some impact on their cardiac function, and double checking an echocardiogram again or a MUGA scan.